This is a special report from News 3 WSIL.
Hello again, I'm Mark Kiesling. Tonight we continue our COVID conversations. This week we've been looking at COVID-19's impacts on our region and what it means for you. Here's my co-anchor, Julie Williams.
Yeah, thank you, Mark. We're joined tonight by Mr. Steve Priebe, a certified physician's assistant from Pinckneyville Community Hospital. Mr. Priebe, I want to thank you for being here this evening.
You're very welcome.
And I guess to start out here, kind of walk me through what your day-to-day has been at Pinckneyville Community Hospital.
Okay, well, I am a physician assistant certified, as you said. I spent 15 years in a medical laboratory, or 15 years in a medical laboratory and 21 years as a physician assistant. So I'm involved in medicine for 35 years now plus. So I've had a lot of, my day-to-day is working in a family practice setting at Pinckneyville Hospital in a family medical center. So I see kids of adults, children, people of all ages, elderly. So we get everything. Yes, yes.
Great, thank you. And can I ask, to start out here, we're hearing a lot about how hospitals are overrun right now with people coming in, with COVID cases. What is it like in Pinckneyville right now?
Yes, we're seeing a lot of that. We're seeing a great increase in the number of COVID patients symptom-wise and diagnosis. I've seen a lot more patients being diagnosed with COVID-19, not only in the emergency department, but also in our office. Yeah. I see. So it's something we're having to deal with. I'm seeing a lot more. It has increased substantially.
And may I ask, however much you're able to answer this, but of those cases that are coming in, are folks vaccinated? Are they not vaccinated?
Largely, we're seeing most patients are unvaccinated. Okay. Unfortunately, that we see a few cases that have been vaccinated, but the large, and across the country, we're seeing greater than about 95% of the cases currently are mostly unvaccinated individuals.
Right. And may I ask, too, in those cases, do you see a difference in symptoms with folks who are?
Generally not, because they're presenting to us. If it's a very mild case, whether it's vaccinated or unvaccinated, they're not. If it's a mild case, we're not seeing them. They're only seeing them if they have two severe symptoms. By symptoms, I mean, we see a lot of cough, cold, sore throat. Yeah. Well, that goes with many different types of viral, bacterial illnesses. Yeah. We see that. So what I look for is people that their symptoms seem to be increasing more over the last several days. They're very short of breath. They're wheezing. They seem to be more concerned. And the ubiquitous symptom, it seems like I haven't seen in other disease states, infectious disease, is the loss of the sense of taste and smell.
Interesting.
That is a giant, what we call red flag for COVID-19.
Pretty good indicator there. And
yes, yes.
Pinckneyville does have a COVID unit, yes?
Yes, we do have a COVID unit, and it's on the medical floor. We've sealed off one wing, and it's only isolated from the rest of the hospital. When our staff goes in there, comes in for their shift, they are assigned for the COVID unit or to treat the other people that are admitted. So, and I get a lot of my data from my son is a nurse practitioner at the hospital, Miles, and he helps run the COVID unit. He is a hospitalist there.
Wow, and I do have a viewer question on that too. When someone comes into your hospital with severe COVID symptoms, what are you able to do for them?
We have a great staff there that is trained with the COVID. We have a COVID hotline that people can call in anytime and talk to staff 24 hours a day, 7 days a week, so they can talk to the people about that. We have immediately if they come in and they're ill, you put them on oxygen, of course. We have a great respiratory therapy department who's skilled in providing ventilator therapy if necessary. We do give the medicines for that, remdesivir, and so we are very capable of taking care of the symptoms of that. Okay.
Yeah.
So if it becomes a situation where they do need extended care, yes, we try to transfer them to a intensive care unit. Our COVID unit is for COVID. We can take care of them what we can at a small hospital.
I see.
If they become much more ill, then we arrange transfer where we can, but that's becoming a giant problem for small hospitals.
I was going to ask, have you seen a lot of those kind of cases come through Pinckneyville?
Yes, yes. So there have been some cases like that where we've had to sit with them in ER on a ventilator and wait for a bed to open up in an intensive care unit. This has become much more problematic over the last several weeks, the last month.
And if I may, what is that process like, having to sit with someone waiting for a possible ICU bed to open up?
It is very hard on the staff. And I was talking to Miles about this, my son, where he's seeing on a lot of, not only here, but I'm sure it's everywhere, people are becoming burnt out, so to speak, because it requires so much care for these individuals.
Yeah.
And it's hard to see them suffering like that. So then we've had people leave the hospital. Then the ones that stay, it becomes more burdensome on them, working longer hours, longer shifts to care for these individuals.
It's a tough situation to
It's a tough
be
situation,
in.
yes.
Yeah.
Yes, it becomes almost like catch-22, and it's very difficult.
And you said, you know, for small hospitals like Pinckneyville, what resources do you have for these patients who come in with mild or severe symptoms?
Well, we have, like I said, we have we'll keep them on oxygen, we'll keep them isolated, we'll treat their symptoms, and we can give the remdesivir, which is a viral agent, antiviral agent, I'm sorry, through the IV, and keep them on fluids, and to keep them stable.
Yeah.
Okay.
May I ask too, for your staff, what safety measures do you all have in place to protect
Certainly on the
yourself?
staff, everybody, we have in place that all patients, visitors, employees wear a mask inside the hospital.
Yeah.
All hospitals are kind of high-risk areas. All high-risk areas are recommended to wear a mask. And as providers, we are supposed to wear double mask whenever we see patients.
Wow. Okay. And may I ask too, do you think masking is a suitable prevention measure against spreading the virus?
That's become such a political question, unfortunately. I think it's very valuable for a mask to be worn, especially by those not vaccinated. Okay, that's where, to me, that is the most necessary place for masking. The other thing we have in place for COVID, to prevent people from coming in thinking they may be exposed, and just so it's comfort, is telehealth visits. We can see patients for routine follow-ups, stuff that doesn't require touching with telehealth. It'll be a video chat with our phone, or we can actually do phone visits.
And would you recommend that for someone?
Oh yes, definitely, definitely. Especially for the elderly, those with lots of comorbid conditions. Yeah. Something like cancer, being immunosuppressed, immunocompromised because of radiation or chemotherapy, raging diabetes, hypertension, especially your chronic obstructive pulmonary disease patients that already, and asthma, that are already having trouble with their breathing. But it seems like COVID-19, the largest factor that's causing morbidity, mortality is the breathing. Is affecting their lungs.
All right. Well, thank you, Mr. Preby. We'll go ahead and check in with you back here in a minute, but for now, I'm going to go ahead and send it back over to my co-anchor, Mark Kiesling here.
Thank you, Julie. Let's take a look now at case numbers from states in our region. Illinois health officials today report 3,100 new cases and 14 additional deaths. In Missouri, the 7-day average of new cases of COVID-19 is now 2,600. And in Kentucky, officials say 4,800 new cases were reported today, along with 9 additional deaths. More local institutions are returning to mask mandates. Johnny Logan College is going to require masks on campus. That policy begins tomorrow and continues until further notice. Officials say they will continue to assess the situation and adjust when necessary. SIU started classes this week with masks mandated across campus. Masks must be worn while inside buildings when other people are around. According to the administration, most students are following the rule.
You know, our students are very good about complying with this rule. Our students are very smart and are very reasonable. And so they have been complying with this. Again, this is based on the guidance from the CDC and the Illinois Department of Public Health, and so we are always relied on public health experts.
We talked to students on campus too. They agree most people are complying with the indoor mask mandate. If you're planning a hike, make sure you bring your mask even if you're vaccinated. Staff at the Shawnee National Forest say you must wear masks in all of their indoor facilities and if you can't achieve a 6-foot distance outside. Jennifer Randolph Bollinger, the National Resources Coordinator with Giant City State Park, says these policies also extend at all Illinois state parks.
Come out and recreate, be outdoors. Those policies haven't changed. We're recommending that when you can't social distance, to wear a mask.
Just be a kind hiker. Allow plenty of distance between you and other hikers. If you get within 6 feet of another hiker, just make sure to pop that mask on real quick.
This comes as both the Shawnee National Forest and Giant City State Park see more traffic than usual. They both want their grounds to remain a healthy place to find solace during a crazy time. Schools continue to determine the best ways to keep children safe. Some decisions have proven controversial, but COVID-19 case numbers in schools are climbing, and hospitalization rates for young people with COVID are at their highest since the beginning of the pandemic. Camila Bernal has more.
As children return to school, heated debates over mandatory mask mandates among parents and politicians.
Government's masks are effective. This is authoritarianism, and you are virtue signaling.
Health experts say that masks are the most effective way to protect against infection for children under 12 who are not yet eligible for the vaccine.
Even in a school system where you may have vaccinated teachers and some of the children may be vaccinated, you want to wear a mask to protect the children so that they could continue to be in school.
But some governors, like Florida's Ron DeSantis, say parents, not schools, should decide whether their kids wear a mask in the classroom. DeSantis threatened to withhold the salaries of school officials who impose mask mandates. And the Republican says quarantining, quote, healthy kids after a possible COVID exposure in schools should be up to the parents, too.
Parents whose kids very well may already be immune, who may have a passing contact, I think if they're healthy, I think that they should want to get them back as soon as, if they want to get them back as soon as possible, I think the school district should work on that.
But health experts say the risk is far too great.
The risk is not just to that child, it's to the rest of the group.
Thousands of students and employees have tested positive for COVID-19 across Florida's largest school districts since the start of the semester. I'm Camila Bernal reporting.
And we'll go ahead and check in with Mr. Preeb again here. We're hearing about, COVID cases in school. With the school year starting up, are you nervous about seeing an increase in cases in Pinckneyville?
I think that's a distinct possibility. Yes, I think our school districts are doing a wonderful job with the data they have to prevent this from occurring. So, is it a worry? Yes. Well, my grandson just started kindergarten, so I'm a little nervous about that. But I think everything will be fine because our school boards, our school district, are doing everything they can, and they have the data available to make sure that to keep the cases at a minimum.
And kind of going back to when someone comes in with a case of COVID-19, for those more mild cases, mild symptoms, someone who doesn't have to be hospitalized, what can that person do to keep themselves out of the hospital and keep themselves
safe? The best thing they can do is treat, from my perspective, from my years in is treat the symptoms as far as the cough, congestion, runny nose. Fever, I was always taught since I was at the SIU PA program, fever is our friend because it is the one weapon that the human body has to fight off viruses, bacteria. They like to live at the ambient temperature of the human body at 98.6. Well, the body temperature is raised automatically by the body to fight the authentic antigen. If the child, especially a child or adult, feels bad with a fever, then go ahead and treat it. Maintain a good hydration status. But I stress to all my patients, should they start feeling worse, especially shortness of breath, wheezing, coughing, just unable to tolerate any food, fluids, just feeling worse, please go to ER or call our COVID hotline.
Okay, interesting point there. And if someone is feeling ill at home, when do you recommend that they get tested even for COVID-19?
One is if they're concerned about it at all, or if they have any comorbid conditions. Like comorbid, I mean obesity, sore throats, obesity, diabetes, hypertension, asthma, heart disease, cancers, anything like that. Then you should be, and you're concerned you have the symptoms, get treated or get tested, and we'll see if treatment is necessary then.
Great. And when someone comes into the hospital with COVID-19, what are kind of the admittance criteria to say you can, you need to be here or you can help fight this virus off at home?
It's difficult for me to answer that. I don't work in the emergency department. I don't do the inpatient. I'm strictly, but I think the admission criteria would be that you do have these comorbid conditions. You do not have a good support at home to take care of you. And there's a good support staff. Or your symptoms show that you're dehydrated, your white count is high, you just don't look good. Okay.
Yeah. And I think a lot of folks are kind of antsy or anxious to get, back out into the world and, kind of relive their lives again, especially with, summer ending. What would you say to folks, even with state fairs coming up, what would you say to them to keep in mind?
Get the vaccine. I think that is the #1 tool that we now have in our armamentarium, or toolbox, to fight off COVID. Because currently we know that not greater than 95% of COVID admissions are for people who did not get the vaccine.
Right.
Okay, with the state fair coming up, you have to understand that the vaccines, two things about the vaccines. One is for Moderna and Pfizer, you get your first vaccine, you wait 4 weeks to get the second vaccine, and it's 2 weeks after that before you become fully vaccinated against coronavirus. So you're looking at start today, you're 6 weeks out before you are fully. When Johnson & Johnson is a one shot, and it's 2 weeks after that before you become fully vaccinated. And the other thing I stress to my patients about and people is vaccines are not 100%. No vaccine is 100%. There's going to be a few breakthrough cases. It just happens. That's just the nature of biology and the human system, that there will be some failures. But these failures are very low. The last data I saw from it was I just looked before I came today from August 9th. There's been 8,050 some cases of breakthrough cases that have required hospitalizations or death. That's out of 170 million people who have had the vaccine. So it's showing to me that the vaccine is very effective at preventing serious illness and death.
And Mr. Pree, being someone who works in the healthcare field, is there anything you want to say to folks tonight, just as we continue to fight this pandemic?
Not really, just take care of yourself. Be cognizant of the world around you. If you have the comorbid conditions, use common sense, stay away from crowds, get the vaccine, and be diligent that if you are feeling symptoms, contact your provider so you can be tested.
Mr. Pree, I want to thank you so much for joining us for our COVID conversation tonight.
You're welcome.
And we will have this entire interview and much more COVID-19 information on our website, WSILTV.com.